Special Beginnings in Arnold is a place that definitely lives up to its name. I got a chance to take a tour of the birthing center recently and talk to some of the midwives about the experience there for the staff and for the families who choose them. Joanne Hasman has been a nurse midwife at Special Beginnings for almost 18 years, and each experience with the new mother still leaves her in awe.
There were 13 people in the room when the baby was born, and the baby came out and they all clapped. They all just clapped, and it was so nice. You know, it was fantastic.
She says assisting in the birth process never gets old.
The nicest part of it is that we get to support women in labor and their families in a home-like environment with not a lot of extraneous outside influences. It's a comfortable environment. We get to practice midwifery the way that we would like to, supporting women. There's not a lot of intervention here, and the clients at the birth center are basically really low-risk clientele. So if we have someone who needs more than what we can provide here, then we would take them to Anne Arundel Medical Center.
Nurse midwife Rachel Clark hasn't been a midwife for quite as long. In fact, this is her very first position. But it's a calling she's felt for a very long time.
I've always been passionate about birth center care. I think that women should have options to deliver in the setting of their choice with the care provider of their choice. And I came here from a state where that wasn't possible.
Special Beginnings caters to women with low-risk pregnancies. Labor and delivery happens in a bedroom-like setting with a calm and nurturing ambiance, very much a home-like feel.
There's not as many bright lights and people coming in that you don't know. You have a relationship with your care provider from during pregnancy, and it's the same care provider.
Mother and baby are still monitored, and nurse midwives are careful and astute in any changes that can happen in labor and birth. While they don't use epidurals, if a mother opts for pain control, there are two options that they use, but that might not be available at a hospital. Nitric oxide, like what you get at the dentist, or laboring in water.
So water birth is a big thing for a lot of people. They want to be in the water for comfort. It's a way to relieve pain in labor. It kind of just relaxes the body and the muscles and lets you kind of relax into your process.
Special Beginnings takes most insurance plans, including Medicaid, and is actually preferred by many insurance companies.
Midwives provide equal standard care at a cheaper rate because we are high-touch, low-tech. We do a lot of getting to know our patients, and we don't do as many interventions, especially in the birth center.
What you can't put a price tag on? The feeling you get of delivering with a nurse midwife who is just as excited for you as family.
There are times when a baby comes out and mom and dad cry or the grandma cries, and I'm there going, oh, this is wonderful. I cry too, you know.
Because they get it. Unlike a hospital, there's no cap on the number of people who can experience a birth with a new mom. There's also no age restriction for a child or young adult who wants to be there.
A birth isn't just a single thing for the mom. I mean, it's a family affair, and it's part of the whole development of the family, and children involved. Children get to come to the birth. They get to see their new baby brother, baby sister sometimes be born if they want to be in the room at the birth, or sometimes just right after they can snuggle in with mom and new baby. So there's no separation. Maybe there's less likelihood to be jealousies from kids because they're here at the birth. And I think it really helps for people to bond with the baby. And it's a really big moment in a family. It's going to be entirely different and great and wonderful. And I get to be a part of that. You know, I get to be at the beginning of that change in their lives. And it's just miraculous as far as I'm concerned.
In addition to labor and delivery care, Special Beginnings offers well women and contraceptive care. They also train midwives, so if that's something you're considering, you can reach out to them as well. We'll be right back with more Midday Maryland right after this.